Imagine a world where every mind works a little differently, shaping how we see, hear, and feel. In this video, we'll explore what autism really means, moving beyond myths to discover the facts and the remarkable diversity of the autism spectrum. Whether you're new to the topic, know someone who is autistic, or just want to understand more, join us. Let's begin our first look at autism. Autism isn't an illness. It's a neurodevelopmental condition, part of the natural variation in human brains called neurodiversity. Officially Autism Spectrum Disorder, or ASD, the spectrum is key, representing a wide range of experiences. No two autistic people are alike. Differences often appear in social communication, deep interests, and repetitive behaviors called stimming. Strengths can include an amazing ability to focus and a strong sense of justice. Understanding autism is key to a more inclusive society. Without it, common traits can be misunderstood. A need for routine might be seen as inflexible or direct communication as rude, creating barriers and isolation. But knowledge turns judgment into empathy. It helps us ask supportive questions like, how can I help? Embracing neurodiversity benefits everyone, building a future where different ways of thinking are valued and every person is respected. Autism, or autism spectrum disorder, is a lifelong developmental condition that changes how a person perceives and socializes, causing challenges in social interaction and communication. The term spectrum is key, highlighting a vast range of symptoms and abilities, a complex web of strengths and challenges. Autistic people are diverse, with different personalities and ways of communicating. In the US, about 1 in 36 children are diagnosed with ASD. Autism symptoms fall into two main categories. The first is challenges in social communication and interaction. This can include difficulty with back-and-forth conversation, understanding nonverbal cues like facial expressions and body language, or sharing their own emotions. The second category involves restricted, repetitive behaviors, interests, or activities. This includes intense, highly focused interests and repetitive movements, often called stimming, which can be a way to self-regulate. Many also have a strong need for routine and experience sensory sensitivities, where sounds can be painfully loud or textures unbearable. These traits stem from how their nervous system processes the world. It's important to remember autism is a spectrum. The intensity of symptoms can vary greatly from person to person, and even day to day, depending on factors like stress and environment. What causes autism? Research shows there's no single cause, but a complex mix of genetic and environmental factors that influence early brain development. Genetics play a major role. Scientists have identified hundreds of linked genes, not just one. These genes can be inherited or occur spontaneously, affecting how brain cells communicate. Environmental factors, mostly during pregnancy, can also increase risk. This includes advanced parental age or birth complications. These factors don't cause autism alone, but increase risk when combined with a genetic predisposition. Crucially, we know what causes autism. The claim linking vaccines to autism has been thoroughly debunked. The original study was retracted, and massive global studies find no link. The scientific community is united. Vaccines are safe and do not cause autism. The autism spectrum isn't a line from high to low functioning. That model is harmful. A better analogy is a color wheel, representing a unique profile of strengths and challenges. An autistic person might excel in one area, like writing, while struggling in another, like verbal communication. This is why diagnosis now uses support levels instead of outdated labels, focusing on providing the right support for each individual to thrive. Diagnosing autism isn't done with a medical test. Instead, specialists evaluate a person's behavior and developmental history through interviews and direct observation. They look for difficulties in social communication and restricted, repetitive behaviors. A diagnosis unlocks access to support and services, helping the individual thrive. For an autistic person, home is a sanctuary from an overwhelming world. Daily life is often structured around routines which provide safety, so even small, unexpected changes can be deeply unsettling. Communication may need to be more direct and literal, as sarcasm can be misunderstood. The home environment is also adapted for sensory sensitivities, with things like quiet zones or a sensory corner, with soft blankets and fidget toys where the person can go to self-soothe and regulate. School and work environments can be challenging. In school, noisy classrooms can cause sensory overload, often mistaken for defiance. Accommodations like quiet spaces or noise-canceling headphones aren't an unfair advantage. They level the playing field. Similar hurdles exist at work. Traditional interviews can be difficult, contributing to high unemployment, but companies are adapting with skills-based interviews and sensory-friendly offices. By making these changes, employers tap into a pool of talented workers and create a more inclusive culture for everyone. While complex social rules can make friendships challenging, autistic friendships are often incredibly deep, built on shared interests. The internet has been transformative in helping people connect and find community. This is a place of belonging where one doesn't have to mask their traits to be accepted and understood. A common myth is that all autistic people are savants. In reality, savant syndrome is rare, and autistic people have a diverse range of abilities. Another harmful myth is that they lack empathy. The truth is, they often feel emotions very intensely, but may process and express them differently. Finally, autism isn't something you outgrow, it's a lifelong condition. What might look like outgrowing it is often just masking, hiding autistic traits to fit in, which can be exhausting. Let's challenge some stereotypes. An autistic meltdown isn't a tantrum, it's a neurological response to being overwhelmed. Repetitive behaviors, or stimming, are a vital self-regulation tool. The rise in cases reflects better awareness, not an epidemic. And the myth that vaccines cause autism has been thoroughly debunked, originating from a single fraudulent study. To support an autistic person, adapt how you communicate. Use clear, direct, and literal language, avoiding sarcasm or idioms. Be patient, allowing extra time to process and respond. If verbal communication is overwhelming, try using written words, pictures, or gestures. Respect sensory needs, like sensitivity to bright lights or loud sounds. Simple changes can help, like offering a quieter spot or dimming lights. Support the use of tools like sunglasses and noise-canceling headphones, and always provide an escape from overwhelming environments. Predictability helps, so provide a clear schedule and give advance warning of changes. Also, learn and respect personal boundaries. Always ask before physical contact and support their right to say no or leave a situation. This builds trust. Genuine support means acceptance, not just tolerance. Learn about autism from autistic people to move past stereotypes. Embrace their passions, show curiosity, and always presume competence, even if they communicate differently. Your support can make a profound difference, helping build a more compassionate and welcoming society. Autism isn't a puzzle to be solved, but a form of human diversity. True support means removing barriers and listening to autistic voices, moving us from awareness towards meaningful acceptance. Embracing neurodiversity enriches us all, building a future where everyone is seen, respected, and celebrated.